Really ready. Hello, Assalamu alaikum and good evening. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. How are you this Saturday evening? Hoping you're having a great start to the weekend. And as always, we try to bring you a program that is informative in a way that it can get sort of, many things straight. I mean, there are so many things we're confused about when we're talking about health. There may be myths and facts that need to be sorted out, and there may be many things that's the reason we have experts in with us in the studio who can talk to us and tell us about what we should be concerned with. Today's program is about urological diseases, and for that we are very happy to have with us in our studios Dr. Sajid Mumtaz Qazi, who's a consultant urologist and head of urology unit in PIMS. Thank you very much for joining us here today.
Thank you very much for inviting me to your show.
Our pleasure. We are going to talk to our expert, about urological diseases, but right now let's have a look at this report. And this report is going to tell us about, 8 habits that can damage your kidneys. So let's take a look.
Habit number 1. Insufficient water intake. You are putting your kidney at risk if you don't drink enough water. As already said, the main function of our kidney is to drain out metabolic waste from our system, and balance the erythrocyte in our bodies. When you don't drink enough water to make this process running, it will lead to accumulation of toxins in the body. Number 2. Keeping your bladder full for prolonged time. Urinating at the right time is highly recommended to maintain kidney health. When we prolong urinating, it leads to lots of complications, like increase of urine pressure in the kidneys, also called hydronephrosis. This can lead to back pressure on the kidneys, and also results in renal failure. Number 3. High salt consumption. Salt contains a high amount of sodium, and the majority of our sodium intake needs to be expelled, which puts our kidneys in stress when we consume them in excess. Number 5. Diet high in proteins. Usually it is healthy to consume proteins, but don't consume it in excess. Too much protein increases the metabolic loads, and can damage the kidney condition in the long run. Number 6. Excess consumption of caffeine. Having too much caffeine containing foods like chocolate, drinks like coffee, soft drinks and energy drinks can cause high blood pressure, which in turn will put a strain on your kidneys, over time leading to kidney failure. Number 7. Smoking. Smoking increases the blood pressure and heart rate. In addition, it also reduces the blood flow and narrows the blood vessels in the kidneys. It can even accelerate the dysfunctioning of kidney, and worsen existing kidney diseases. Number 8. Intake of painkillers. Taking painkillers for low-grade pain are not good for your kidney. Medical experts warn that taking pain pills on a regular basis will reduce blood, and it deteriorates the functioning of kidneys. Now that you have seen 8 most common daily habits that damage your kidneys, take good care of these habits, and stay healthy.
Okay, quite a few eye-openers there. I mean, I was reading that list and I was thinking, okay, what am I guilty of there, Because sometimes there are things that you're doing on a daily basis and you're not really realizing that this is something that is damaging. We will talk about these points as well. We'll bring them up in the program, in the course of the program. I wanted to start, with asking you that what is a urologist concerned with?
Actually, urologist is a field of medicine where you deal with urinary disease. Mm-hmm. It includes urinary system of the male and female, and the genital system of male especially. Mm-hmm. I mean to make one thing more clear, that any problem which is related to the male urogenital system, reproductive system, That is inclusive of urology, in
Right.
addition to the kidney disease and urological
Right,
diseases.
right.
So any problem which is related to these systems, urologist is supposed to deal with that.
Right, okay. So that makes it clear to our viewers as well who are watching the program that, you know, these are the areas of concern for a urologist. Yeah, okay, right. When we talk about the function of the kidneys and the importance of their well-being, do you think that in the patients that come to see you, that people are really actually aware of how we are mistreating our kidneys, if not anything else?
Of course, I think most of the people, they don't take care of their health. One reason behind this is just lack of health education. What to talk about health education? You have one of the lowest literacy rates in the subcontinent and all over the world. So the people, they don't take care of their health in general. And while talking about kidneys, of course, they do need to take care of this. They should take a lot of fluids, especially in summers, especially in the daytime when there is quite, say, this dry and hard weather. And for this, they need to get their checkup thoroughly and routinely at around about 3 to 6 months intervals.
Okay, what tests should those be?
Routinely, only 2 tests should be done.
Right.
This is urine routine examination,
right,
and renal function test.
Right,
And
okay.
if you are suspecting some kind of renal problem, then one should also undergo ultrasound.
Okay. And that will be after the renal function test, or if somebody's
Depends upon the symptoms.
Okay.
So depends upon the symptoms. If somebody presents with, say, renal pain or the pain in the renal area, you can have different type of pains in the same area.
Right.
It's not always that you have any pain in this lower rib cage area,
Right.
which is renal in origin. You can have also pain due to different reasons.
Okay.
And we'll discuss it, what other pains you can have in this area.
Right.
In that case, of course, one should go for ultrasound so that to exclude any renal pathology.
Right.
But otherwise, just to check out renal functions,
Yeah.
you don't need to do ultrasound.
Right,
You just
okay.
need to do urine routine examination and renal function test, that is serum creatinine.
And this is what you're saying after every 3 to 6 months? This is what every individual should be
Depends
doing?
upon, not every
Yeah?
individual.
No?
They should at least undergo annual checkup.
Annual
checkup.
checkup, right.
And
So
the patients who are suffering from kidney disease, they should undergo 3 to 6 months checkup.
And especially if it's in the family?
Yes, especially if they are having kidney disease in the family, then one should keep a more
Be
thorough
on
checkup
top of the disease, exactly. So that, you know,
Sure.
this is very important advice that Dr. Sajid is giving us, that if you have kidney diseases in the family, it's good to be, you know, screening after every 3 to 6 months. And he's saying the renal function test and the urine routine examination. Otherwise, if you're seemingly healthy, then you would want to do that once a year.
Once a
would be-
year.
Yeah? Okay.
At least once a year.
At least once a year, okay. So, right, one thing that we find going on a lot in Pakistan, you know, you hear nearly every other person complaining of having kidney stones. And, you know, you'll hear about people who have recurrent kidney stones, or this has been going on for ages and ages. Is this something to do with our demographics, something to do with our genetics, or is it the same, is it globally?
Definitely it has to go do with both of these, demographic as well as genetic.
Okay.
Pakistan is located in the stone belt. So any area which is close to the river, close to mountain and close to desert, the people are prone to get this stone disease. Especially the areas of the Pakistan where this is, it is close to the river, like Sindh belt. Again, the northern areas having this mountaineers. These people have quite large number of people who have stone disease. And again, the people who are having this stone disease in their family, they are prone to get this stone disease.
I see.
Of course,
So
because this is
something
genetically transferred
Uh-huh.
to next generation.
Okay.
So they must get their kidneys thoroughly checked.
Okay.
As I told that they should be doing this at least routine examination for 3 to 6 months.
Right. If you have kidney stones in the
If you have
family.
kidney stones in the family.
That's another reason for you to be getting your, your screening done after every 3 to 6 months. If you have kidney stones in the family, then you want to keep getting your urine RE and your renal function test after every 6 months, as Dr. Sajid is saying. Okay, so what are the symptoms of having kidney stone?
Well, it varies from person to person.
Okay.
Nowadays, you can detect so many dormant stones which are just lying silent in the kidney, which are not causing any kind of symptoms, which are not causing any sort of pain to the patient. Silent stones. We call them silent stones.
Okay.
Most of the time, these stones are just lying on the sides of the kidney because the drainage system of the kidney is very complicated. It consists of multiple complicated tubes which finally join to drain the urine into the urinary bladder. So if the stone is just lying on the side of the kidney, which we call the calyces of the kidney, most of these patients won't have any pain.
Okay.
They won't have any symptoms. Again, the soft stones, they don't cause symptoms till the failure of the kidney. Most of the patients, they do come with the failure of the kidney in these cases.
So they would be in such an extreme situation.
In
that
extreme
They
situations.
would not know that they had this stone until actually they were going through the failure.
Yeah. This is about the soft stones. Soft stones. Most of these stones are infection stones, calcium phosphate stones. Most of these patients will present very late in their age because they won't come to know. They won't be having any symptoms regarding these stones.
And it wouldn't be detected in the routine examination or the kidney function tests?
No, not in kidney function test unless and until they damage 75% of the kidney. Because it is only reflected in the kidney function test, urea and creatinine rises once the 75% of the kidney is already damaged. Then they start deteriorating. Otherwise, you won't find them.
Are they not picked up in ultrasounds either, the soft stones?
You can detect them in ultrasound. You can detect them in ultrasound, but not on routine urine examination and not on renal function test unless and until it is damaged. So we were talking about what are the symptoms. So one of this variety, they won't cause any sort of symptoms. So they are just dormant or silent stones.
Right.
Again, the most common symptom of stone disease is pain.
Right.
And this pain varies from person to person.
Okay.
In most of the cases, it would be pain in the lower rib cage on the back, which usually radiates to abdomen, front of the abdomen.
Right.
And most of the time it is associated with some kind of other symptoms like nausea, vomiting. Patient may have some urinary symptoms, like he may have irritable symptoms, but the most common symptom where you suspect that this pain may be due to stones is blood in the urine that we call hematuria.
Okay.
Most of the patients, they do pass blood while they're having this kind of pain. So once this pain is associated with these symptoms, there are very high chances of having this renal stones.
Okay, right.
So again, these are most common presenting symptoms. As I told you, in few of the cases, while they don't present with initially with these symptoms, they can present with renal failure.
Oh.
God forbid. In case of renal failure, they will be having loss of appetite. They will feel generalized weakness. They will come with low output of the urine.
Okay, that's one of the major signs.
Yeah,
then.
major
Okay.
signs.
Right.
With loss of appetite. And in severe cases, once they are in uremia, uremia is the state of blood where the say these products like urea and creatinine, which are normally excreted by the kidney, they deposit in very large amount in the blood. And then they cause damage to different systems of the kidney. right from the gut till the your nervous system. So patient can present with decreasing this general health. His mental capacity is gone down, and he can present with seizures even.
Okay. So, right, because we're talking about renal failure right now, we'll just, sort of talk about that as well. But renal failure, then what happens? What is the treatment there? Dialysis?
Renal failure actually is a very wide term. Renal failure is a state of the kidney where the kidney is damaged. So there are different classifications for it, starting from that we call this chronic kidney disease. Once the renal function is gone down and his creatinine continues to rise, that condition we call this renal failure initially.
Okay.
But end stage renal failure is the condition where his glomerular filtration rate comes less than 5 milliliter per minute.
Okay.
5 to 15 milliliter per minute. That stage we label as end stage renal failure, where no other option is left than dialysis or to replace the kidneys. One need to do this renal transplant as an alternative, which is a better alternative as compared to dialysis. In healthy patients. Healthy, I mean to say the patients who can undergo the surgery.
Of course.
They can withstand surgery.
Right.
Those patients, they are candidate for either dialysis or transplant.
Transplant, okay, right. Back to the stones now. Okay, you've told us about the symptoms. Now, when a person is undergoing the diagnosis, what exactly happens there?
I haven't got your question.
After the symptoms are presenting and a person goes to a urologist, what diagnosis will take place? What are those steps? Ultrasound?
Okay. You need to undergo a few tests.
Okay.
Out of them, you normally, after doing this urine routine examination and culture, one would go for renal function test, ultrasound, and in some cases you need to do CT scan.
Okay.
Depends which patient are a candidate for CT scan. Again, in few of the patients where you suspect that the kidneys are badly adversely affected, you need to do sometimes renal isotope scan also to evaluate the renal function. So these are different steps to diagnose renal disease and renal stone disease. What is the severity? What is the intensity of the disease?
What is the size of the stone? Is it blocking any sort of the kidney?
You can evaluate the size of the stone. You can know about what is the exact location of the stone, how much damage it is causing to the kidneys, how much, effort is needed to sort of relieve his obstruction, what kind of procedure you will adopt to remove the stone. That is all decided on these detailed tests.
Right, and every individual patient, of course, will need a different treatment.
Of course.
Okay, so what are the standard treatments that are available then for a person who is presenting with kidney stones? And
as I already told you, that the stones which are just lying on the side and they are in small in size, any stone which is less than 5 millimeter is supposed to pass spontaneously.
Okay.
So you don't need to do anything.
Okay.
You can just observe him and follow up. God forbid, in case if it is causing some sort of obstruction to the system, if it is lying in the kidney, one can undergo ESWL, that is extracorporeal shock wave lithotripsy. That is one of the method by which we just break the stones with special kind of waves which are generated outside the body with different sort of mediums. They cause cavitation force and shatter the stone in pieces. And stone later on can pass spontaneously through urinary passages.
Is that a painful procedure? Or
not very painful. One can do it even under, just after giving some sort of painkillers and NSAIDs. That would be sufficient for the patient to undergo this kind of procedures. It's not painful at all.
Okay, and one session would be enough, or does a person
depends
have to
upon the stone size. Depends upon the stone size.
Right.
The patients who have stone size up to 2 centimeter in the kidneys,
2 centimeters
2
is
centimeters.
quite a,
It's quite a
that's enormous. Sort of.
reason, yeah,
Yeah.
But still, these patients are suitable for lithotripsy.
Okay.
Yeah, one can undergo lithotripsy if the stone size is up to 2 centimeter. We can undergo ESWL.
Okay.
Again, if you don't have these facilities, the other procedures are PCNL. PCNL is, that is percutaneous. We go through a small, say, wound in the body, and through that into the kidney. And after puncturing this, the system of the urinary system, you just reach the kidney in situ and break the stone there in the body.
Right.
This procedure you need to do either under spinal anesthesia or usually most of the time under general anesthesia.
Okay.
In very few cases, one can undergo local anesthesia also, but
it's not advisable.
It's not advisable.
Right.
Most of the times, they will need kind of general anesthesia
Okay. Okay.
for PCNL.
PCNL.
PCNL, that is
Right.
called percutaneous nephrolithotomy.
Okay. How many times does that occur? Is that something that's not very common, or?
PCNL you are talking about?
Yeah, PCNL.
Throughout the world now, this is one of the most ideal procedure for renal stones.
I see.
It's one of the minimally invasive surgeries,
Okay.
and now being practiced in almost all the areas of the world, throughout the world, and also here in Pakistan. But then you need specialized training for that. You need specialized kind of instruments for that.
Okay.
So that is one of the minimally invasive surgeries for any kind of the stones, even larger stones also. The stones which are more than 2 centimeters, I told you that the stone size, if stone size is less than 2 centimeters, one can go lithotripsy.
Right.
If they are in the kidney. Again, if the stone size is more than 2 centimeters, one can undergo this PCNL. And if you don't have the facilities for PCNL, then even you can open procedure that we call pyelolithotomy. They are equally safe and very effective.
Right.
Here in third world countries, they are very commonly practiced. In safe hands, they are very, very safe.
Right. Okay. You've mentioned a lot about uric acid as well. What do we need to? I mean, too much of uric acid. What does that mean? And for people who have, tests and they get too much of a uric acid in their tests, what food should they be avoiding? What can it lead to?
Uric acid is one of the product of metabolism in the body, protein metabolism. And once it accumulates in the body, it can cause different kind of symptoms. One of them is that it can predispose to stone formation.
Right.
Again, it can accumulate into the joints and cause joint pains and discomfort, and sometimes gout. You might have heard of gout, which is one type of the inflammatory arthritis.
Right. Okay.
So people do come with this gout, and they may suffer from myopathies, some kind of muscular pains also.
Okay.
So most of these patients, they present either with stone disease or with gout.
Okay.
The people who are suffering from this hyperuricemia, that is a kind where this level of uric acid are higher in the blood, that condition we call hyperuricemia.
Okay.
And if you have very high levels of uric acid in the urine, that condition is called as hyperuricosuria.
Okay.
In case of hyperuricosuria, there are chances of having this kidney pain because the crystals of the uric acid, they are being passed through urinary system.
Right.
One can have renal colic, one can have this renal pain due to that.
Okay.
Again, they are predisposed to this stone disease, as I already told you. They should avoid especially protein diet.
Okay.
Especially protein diet, and out of that protein diet, they should avoid red meat. And also, in some of the cases where the uric acid levels are higher, they should also avoid this shellfish,
Okay.
lobsters, etc. They should also
Onions?
not.
Do onions have a?
No. Or lobster I am talking about.
Right.
And shellfish. They should also avoid this carbohydrate, very refined carbohydrate diet. And they should also take care of
Red
not
kidney
to
beans, are they okay?
yeah,
They're okay?
of course.
Okay.
And they should also avoid this processed foods,
Okay.
even
We see a lot
like
of people.
the chips,
Right.
potato chips, etc.
Okay.
So
And the fast food as
and
well?
also rice,
Rice. Okay.
white rice. They
White
should also
rice.
avoid
Okay.
white
right.
rice.
Right.
So all these patients who are having this hyperuricemia, they should avoid these foods. And in the meantime, they should take a lot of fluids. The fluids to the extent that their urine should turn like water.
Oh, okay.
That is the
That's the measure.
That's
Okay, now you just spoke about, proteins, having an excess of proteins, and we also saw on the report that, a high protein diet can also cause damage to your kidneys. So, we see a lot of diets that are coming into play at the moment, the weight loss diets, where, it's being promoted to sort of have the least carbohydrates and have, more of a protein diet. And many people are catching on to this. And then you have the keto diet as well, where, you have people wanting to have more of a fatty diet and put your body in a state of ketosis. What do these diets do to a person who is having a kidney problem?
we would advise any patient who is a kidney patient for this high protein diet.
And what about a healthy person? Should how sort of should they how much should they be involved in a diet like this? Can that cause damage to their
I think
kidneys?
for healthy persons, we just advise them to take care of their health through exercise and reducing their intake of calories rather than just putting them on this high protein diet.
Right. So that is very, that is something that is very important, because there are many diets out there, and we find people then sort of, become a bit obsessive with a certain food, and they'll start eating a lot of that, and that can lead to side effects. So the main thing is balance there.
Anything in excess can cause damage to your body.
Okay. So we find bodybuilders take a lot of these protein supplements and everything.
Yes, they are used to get this just to build up their muscles.
That can be harmful?
Yes, they can predispose to this kidney problems also, especially if they are taking high protein diets.
Right. So they should get their kidney tests done as well.
Sure.
Yeah?
Very regularly.
Okay, so if you're into the gym and you're, into your bodybuilding and everything, it's good for you to get your renal function test and your urinary done, so that you're in the picture and you know that while you're making a great, all those wonderful muscles, you're not damaging your kidneys or something like that. Okay, now we spoke about the treatment as well. How do they occur? Is it, as we spoke about the genetics, that you're predisposed to kidney stone disease if you're somebody in the family has it?
There is familial tendency for the
Yeah.
patients whose family run this kidney disease.
Yeah. What about lifestyle and diet? Can that play?
Yes, of course, diet has a very important role in this kidney disease, especially if you are talking about the stone disease. The people who, as we have already talked about, that who are prone to get this high protein diet, they're prone to, of course, get this stone disease, especially if they are hyperuricemic, especially if this disease is running in their family, and if they are genetically predisposed also, one thing. Secondly, in addition to this protein diet, one should also avoid very high quantities of salt. White powder in any form, say even if it
Sugar,
is salt
salt.
or sugar, I won't talk about the other salts. It's poisonous to your body. So one must avoid these white salts.
Right.
On the other hand, excess of coffee,
As was shown in
tea,
the report.
and also these even dry fruits.
Because we've
Dry
got the
fruits.
winter weather
You
coming
have to
on.
take in moderate amounts.
Now that's very important,
need to
because
take in
now
moderate quantities.
we've got the winter weather coming along, and everyone's house is going to be stacked up with the dry fruits, and you find that you're munching a lot of dry fruits, just sitting in front of the television or just relaxing with the family. So which ones should a person avoid? Any particular ones?
The ones who are already having stone disease, the one who where their family runs this stone disease, And the patients, especially who are having this crystal urea, they are the ones who should avoid all these foods, especially all the patients who are hyperuricemic.
Right. They should as well.
They should avoid all these kind of foods. Otherwise, a normal person, he can take anything. He's not supposed to avoid all this.
As long as it's in balance, as you said before. The main thing here is balance, and that's very logical. I mean,
as long as his diet is balanced.
Yeah.
Normal people don't need to fear from this. Right. They can take any kind of diet.
Okay.
The only people who are prone to get this stone disease are the one who are having metabolic abnormalities. You find some kind of abnormality either in their blood or in their urine. If they're having high levels of these solutes which form stones, once you do the tests of the patients who are prone to get this stone disease, are the one who are already having stones, they should avoid these kind of foods.
Right, okay. And also recurrent kidney stones. A person he's been diagnosed, they've gone through the whole procedure, got rid of their kidney stones, and then all of a sudden they find out that they have more kidney stones. So what's going on there with their system?
As we already discussed, most of the people who are having these kidney stones, out of them 10 to 15% of the people, they do have metabolic abnormalities in their body. Metabolic abnormalities are most of the time at the cellular level, and you can't say sort of reverse them.
Okay.
You can just keep sort of check on them.
Okay.
You can slightly modify them with different kind of foods, with different kind of medication. So you have to take care, they have to take care about their metabolism. And what we were talking about?
I asked you that, you know, when you have recurrent kidney stones, what's going on there? Why is a person having recurrent kidney stones?
In those patients who are having metabolic abnormalities, you can't correct the abnormality as a whole, because most of the time it is on the cellular level and enzymatic level, which you can't correct. You can just sort of modify these things.
Okay. Is metabolic syndrome something different to this?
This is part of all this.
Okay.
It's part of
Metabolic
this.
syndrome is a part of this. So you're basically saying that a person who has suffered kidney stones, if they don't change their diet and their lifestyle, they are then going to keep suffering from this problem.
Again, in addition to having kind of metabolic abnormalities, sometimes they do have kind of congenital abnormalities of the system, drainage system.
Okay.
Or sometimes it may be acquired, may be sort of modified or damaged due to some kind of injury, some kind of surgery, some kind of previous, say, disposition to any kind of trauma. So that needs to be corrected. Unless and until you correct their drainage system,
Right.
they will keep on reforming the stones.
Okay. We spoke about, you know, the caffeine element as well. So we are a nation that loves our tea. So how many cups of tea would be advisable in a day for a person, then, you know, a healthy person, and then somebody with kidney stone disease?
It's not only the caffeine, actually the content of oxalate in the tea. That also predisposes to the stone formation.
Okay.
Again, you do say mix milk into the tea, and sometimes even just take milk as a tea. That they call it, say, doodh patti.
Yeah.
So it depends upon how much milk they mix with this tea.
Okay.
I think 2-3 cups is okay. As we already talked about, that moderate amount of any food you can take.
Right.
Even the patients where we ask them not to take calcium-rich diets, they are advised to take calcium diet. At least they need to take 1 glass of milk or 1 cup of any milk and milk products daily, so that they don't reform the stones.
Right. Okay.
Because the calcium in the milk, that also restricts the absorption of oxalate, which you find in many green leafy vegetables and other food items.
Right.
So that prevents stone formation.
Right.
So anything which is advised has to be in moderate quantity.
Can a person who is deficient in calcium, can they end up having kidney stones which have calcium in them? And if so, how do you treat that? Because then
it's difficult for these kind of patients who are deficient in calcium, especially the patients say who are bedridden and who are having kind of this bone disease. Once they are bedridden or having kind of bone disease, blood draws the calcium by itself.
Okay.
There are systems which sort of manage all this. Again, once the level of this calcium in the blood that rises, okay?
The calcium level rises
Calcium
in the blood?
rises, but in the meantime, their bone would be deficient in calcium.
Okay.
So they have to be balanced very sort of.
It's a bit tricky.
It's a bit tricky.
It's
a
a bit tricky.
tricky. It's a
Okay.
bit tricky.
Okay. Right now, we also, saw in that report that insufficient water intake. I think that's something that we do get particularly guilty of, especially in winter. So, what should be the remedy for that then? How much should we be drinking?
God has kept some kind of sensors in your mind which determine how much quantity of the fluid is needed. There are thirst center in the brain that will sort of alarm you whenever you feel like having to have fluids.
I read somewhere that when you are thirsty, it means that you are dehydrated already. Is that just a myth or is that true?
Oh, no, that's true.
That's
true because your brain alarms you that you need to take water. You should.
Right.
You should.
Okay.
And all these alarms which are coming from your brain, they should be taken care of.
Okay, right. We'll come back to the subject. Right now we're going for a break. Stay with us. Okay, welcome back to the program. We've been talking about urological diseases. We've been focusing a lot about, kidneys, their well-being, how you can damage your kidneys, what you need to do, what you need to be careful about. We've been talking about kidney stones as well. Now, Dr. Sajid, let's talk about urinary tract infections as well. How common are they?
Depends. In females, urinary tract infection is very common. Both at a very younger age, but especially at reproductive age.
Okay.
In males, it's half of, say, female urinary tract infections you come across. But again, in the late years of the age, both male as well as the females, they are almost equally effective. There's a very small difference between the urinary tract infections.
Right.
So, in females, the system is prone to, say, have this urinary tract infection due to small outlet. That is the genetic makeup. Due to the genetic makeup of females, they do get repeatedly these urinary tract infections, and it's quite a higher percentage.
Right. Okay, and what are the symptoms of a urinary tract infection then for, you know, women who are at that age where they are susceptible to getting urinary tract infections?
While we talk of this urinary tract infection, all the urinary tract, say it's a quite long tract, which starts from the kidneys and then to the ureters, which are the tubes which carry the urinary urine from the kidneys, and then into the urinary bladder, and also the passage out from the urinary bladder. This is whole urinary tract. But while we simply talk of urinary tract infection, most of the time we'll be talking about the bladder infections.
Okay.
Most of the time, that is cystitis.
Okay.
And if we just take it as cystitis, the most common symptoms of urinary tract infections are kind of irritative symptoms. I mean to say, irritative symptoms mean that one has to repeatedly go to washroom, feels urge to void urine, sometimes even he won't be having any urine in his bladder, or very small quantities in the urine, in the bladder. Again, they need to stay longer in the washroom, not completed their urge. They just feel like having urine in the bladder, even they're not having urine in their bladder. They may face this difficulty, pain in voiding. They may pass some kind of blood in the urine in extreme stages, and they do have some kind of discomfort in their lower abdomen while the bladder fills up, and they need to rush to the washroom. Sometimes they can sort of pass few drops of the blood, which we call urge incontinence, if they are having severe infection. So all these symptoms, they are due to this bladder infection, which we call cystitis. Well, again, if urinary tract involves the kidney area or some area which is, say, parenchymal, which involves the flesh, one can also experience high-grade fever with chills, and they can go into the sepsis sometimes in severe urinary tract infection. That is one of the most severe sequelae of the urinary tract infection one can face.
Right. Okay. You know, some people have a habit of not emptying their bladder as often as they should. So, you know, keeping their bladder full. Can you tell us about the harms that that can do?
Actually, it's better if one voids urine as soon as he feels some kind of signals from the brain, that means he feels some sort of urge. It's better to empty the bladder, because this is a normal signal from the brain to the bladder once it fills. But in the patients who are having sort of urinary disease or urinary tract infection, some kind of other pathology of the bladder, one can feel urge before time. Of course, in that case, you need to sort of restrict it. But in normal cases, while you're having a normal voiding time, one shouldn't prolong this voiding.
It can be harmful.
It can be harmful.
Because many people will find that, you know, they're in they're at work or they're in the office, so they're putting it off. They feel the urge to go to the bathroom, but they don't go because they're sort of like, okay, can just wait, I'm busy or whatever. It's an inconvenience. But that's something that's a bad habit.
Yeah, bad habit, and especially in the old age people, in most of the men who are above 50s, this can lead to sort of inability to void urine. Because in these people, there is a gland which is part of reproductive system, which we call prostate gland. With the passage of time, they experience some sort of changes, which can predispose to different urinary system, two groups of the urinary systems. One is irritative symptoms, which include frequency, urgency, getting up at the night to void urine, that we call nocturia, and also difficulty in passing urine. The other symptoms are obstructive, like their stream becomes very narrow.
Sort of the opposite.
Yeah, it's sort of opposite. These kind of patients who already experience these sort of symptoms, if they delay voiding, they can have retention of urine. They can undergo retention of urine.
Right,
So they
okay.
shouldn't delay it.
Right, okay. Unfortunately, we've come to the end of today's program, but thank you so much, Dr. Sajid, for being with us here today and for giving us such important advice on how a person can look after their kidneys as well. Thank you very much.
Thank you. Thank you very much.
Okay, and with that, we come to the end of today's program. Very, very important points there from our guest. Urological diseases, I mean, so many things. There are so many habits. You know, the preventive medicine and a preventive sort of an attitude is so much better than being on medicines and being on treatment. So why not care about yourself? Why not care about your health? Because we care about so many other things. It's so important to care about how you are doing health-wise. So until next week, stay happy, stay healthy. Bye-bye.